Welcome to Therapy is Dope with Alicia.
And Julie, let's make self help fun again. No, seriously, laughter is the best medicine.
Come and join us as we introduce new ways of thinking and being.
And hopefully get you laughing along the way.
Here we go.
Hi, guys. Thanks for joining us. We are talking about being responsible for our own happiness. And Alicia just informed me that this month is Suicide Awareness Month. So, how perfect timing is this episode?
Yes. I will say this week I have definitely been encountering people who are suicidal, and a topic of our conversation has been, how do we turn that around for ourselves? And it is
Right.
very possible.
And also on top of that, I think we could follow up in saying, how do we deal with other people's negative energies without absorbing it? So you have a gift for that. So it's something that I really wanna pick your brain about, because it's really hard to listen to someone, be someone's shoulder to cry on, or be someone's support system, but not absorb their negative energy and bring it home.
It is really hard. I don't think it's hard for everybody,
Not
sadly,
you.
but I do think it's hard. No, I mean, some people aren't even very empathetic to other people's pain. They're just like, okay, not my problem. See you
Or they
later.
go, ew, it's
Yeah.
gross. So they totally judge it. Yeah, yeah, yeah. That's true. That's true. I see.
If you're a really empathetic person, I do think it can be really hard.
Yeah, that's true. Uh, but I did run past a quote for this episode, and it just totally rings true to me. And it is, when we live our own authentic truth, it gives others permission to live theirs.
Ooh, beautiful.
Isn't that nice?
Yeah, I think it's so hard. We were talking about authenticity, but we live in a world where who's authentic?
Right. How do you even know? Like, where does that end? So it comes to, that happiness, right? When people say it's internal, you got to find it within yourself. And that's such a general statement. Like, how do you make that relatable to you, to each individual person? But we're all so different. And authenticity, like, if you think about when does that start? Because we're so deep seated with these beliefs since we're younger, right? So it's like use the restroom, even like taking a shit in a toilet. You know what I mean? Like, that is a belief that we do, that we don't realize that's culturally, like a first world country, culturally something we do, right? So if you think about it, how do we even know when we start and culture, or culture starts and we end? Like, what's the real difference? And can you truly be 100% authentic?
Oh God, that's a now we're going even deeper, which reminds me, I was speaking to a client about how she has this strange gift. It seems to me, I mean, and maybe I'm reading the situation wrong, but in all my years of being a therapist, I've never seen something like this, where she seems to be able to travel. I know this is gonna sound crazy, into other dimensions.
Wait. Say
Yeah.
that again.
She seems to be able to travel into other dimensions. Like, if
Oh.
she gets high on marijuana, for example, like the entire reality around her just completely breaks down and she enters another realm. And that's, some people would say, psychosis, which marijuana can be a
Mm-hmm.
hallucinogen. So I understand that. But this same thing happens to her while she's awake or when she's dreaming, and at all different kinds of times. So then people might say, well, that sounds schizophrenic then. And again, maybe it is, but it also seems like if we put her in a Native American culture, she
Yeah.
would be a shaman. She would be a spiritual leader, and she would just sit in her teepee and probably travel dimensions and heal people or whatever all day long. So the culture that she's in makes a big
Oh.
difference for how she's seen.
Oh. Wow. So if you think about it, here she'd be like, "Oh, you're a psycho, or you have mental illness." And in like a native culture, or then they would see it as a shaman, and they would actually look up to her and turn to her. So her level of happiness might be completely different. Wow, I didn't think about that. That's so true.
Yeah, so it's hard to tease apart. And it's kind of like both her and I have discussed the fact that it's kind of like, well, whatever reality you're in, it's best that we just accept that reality. Like that's the best for our psyche.
Uh-huh.
However, you can't help but think things might be different if we were in a different culture. I think the same way about what you were talking about earlier with people having a difficult time dealing with other people's negative emotions or circumstances.
Yeah.
And I feel like Europeans are much better at embracing uncomfortable emotions. Like heartbreak, for example, you're allowed to be really dramatic about it in European countries. In the US, we're like, move on, move on, start sleeping with someone else. It'll be fine.
Or not even that. In Asian cultures, you're not even allowed to have those feelings. Like weakness is crying is weakness. So it's like, why are you crying? Are you dumb? Or like it's just a breakup, or whatever those reasons are, right? It's like, ew, you're so weak. It's embarrassing almost.
Yeah. And then if you add in the elements of social media and who's authentic on social media, or putting on even like your professional mask at work, are we
Mm-hmm.
really being authentic? I don't know. There's so many layers to it.
So many layers. What you brought up earlier, right now, that you said you just need to accept your own reality, and that goes back to, remember you were talking about, we were talking on the side about hypnosis, and you said there's a case study, that, well, you could explain it better, but that whole study, it's like, it's basically, if you just accept it and you believe in it, then it is it,
Mhm.
right? So can you explain that a little bit, the hypnosis
Are you
you were
talking
explaining?
about the guy with the spine thing?
Yeah, and the case study where he says, when you really just believe it, then it happens. Like,
Yeah.
I think binding, right? He said he just every day like meditated on that, and it
Yeah.
healed.
Yeah. He had a spinal injury and he decided, they told him he wasn't going to be able to walk again based on his injuries. And he decided he wasn't accepting that reality. And he started doing hypnosis for hours daily. And he would imagine his spine healing. And he learned obviously about the anatomy of the whole thing. And so then he imagined it repairing itself. And eventually it actually did. And he was able to walk again. And, it came down to this idea that our minds are very powerful and we can use them to imagine positive things instead of imagining only negative things, which most therapists know. I think that we spend 80% of our lives thinking about negative things. We spend 80% of our thoughts are negative. And for survival purposes, that makes a lot of sense because we needed to remember when there was a threat of something. So it was burned in our memory when something negative happened so that we could prepare ourselves and survive. But now we don't really have any of those things. We're very privileged. We have everything we need right at our fingertips. Yet we still tend to think only about negative things. So if we consciously choose to think about positive things and positive possibilities, we might have a lot more power than we think we do.
We definitely have more power than we think we do, and it goes back to what's that Lean In book from Sheryl Sandberg? Um,
I don't know authors.
so she was a CEO. She still is, I think, the COO of Facebook. Amazing woman, super strong. And she wrote a book named called Lean In. And in one of the chapters, I remember her saying that a lot of women don't even sit at the table.
Mm.
Like, no, 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 no. You guys sit at the table. They just wait until everybody else fills it. And she's always like, come sit at the table. And their belief is, oh, no, 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 I'm not doing important things. So you guys do it. The important people should sit up there. But if we have the belief that we're not important, then we're not gonna be important. So it goes back to, if you believe you're not happy, if you believe that this car is going to make you happy, this phone is going to make you happy, getting these things or having this body shape or whatever going to make you happy, then and just depending, it's all depending on like an external factor and a dangling carrot. Because once you get there, once you get to that body shape, you're just like, that's it. Like, am I happy forever? It doesn't work that way. And I think that's why that happiness is an inside job, is true. But I want to, I don't know, I kind of want to make it more specific, because doesn't it feel like if someone said you were sad, if someone's like, I'm so sad, I'm so depressed, and they go, happiness is an inside job. It's like, okay.
I would want to punch them in the face.
Yeah. Seriously, it's like, what the fuck? What are you talking about right now? Be like, Alicia, I don't care right now. Whatever, right? What are you pissed off?
Oh yeah, absolutely. I've been in that state before where I'm laying in bed and I'm like, okay, I'm a therapist. I know all the coping skills. And I'm like, fuck that. I don't give a shit. I just want to lay in bed right now.
Yeah.
So, I mean, I can relate to that feeling for sure. And, I'm not exactly sure of the solution. I think it's probably something that takes time to get to, because the truth is when you're in a seriously depressed state and it's hard for you to even get out of bed, it's unlikely that me telling you to change your mindset is going to do much for you. It's just unlikely. But if you maybe pull through that depression a little bit and you get to a place where you can consider doing something like that, then you might prevent yourself from going into a depression for a longer period of time, or maybe your depression period will shorten because you're starting to challenge your mindset.
Oh, you know what? That reminds me, we both have been in a very depressed state in our lives. And I remember when I was really depressed, what helped I didn't want to get out of bed. I was crying, fetal position. I was just so sad. And I was like, does dying feel better than this? And thank God I never had the guts to do that. But I remember doing one thing. Like today I'm going to do one sit up. And then I did that one sit up and it actually changed that moment. It was like, oh, I did that one sit up, just literally a single sit up. And it was like, oh, that wasn't that bad. Then the next day I remember I did I brushed my teeth or whatever. I did such mini steps, but mentally it was huge for me because I just didn't even want to move. I didn't even want to live.
Yeah. And that's the thing, when we get into that mindset, there's not a whole lot anybody can say or do that's going to get you through it. And sometimes I think it's just time and like slowly forcing yourself to do a little bit, like you were saying. And eventually the mood does lift. I mean, if you live through it, your mood will shift. It's just the way that we operate as humans. Nothing's ever permanent. So if you can stay alive, it will go away eventually. It takes time. And if you're functioning, then usually that means you have enough wherewithal to have some metacognition, meaning that you're paying attention to what you're thinking and you can talk to yourself about it. But when you're really deep in it, there's not a whole lot you can do except maybe what you were talking about. And also like medications and TMS and stuff like that can maybe help prompt you to come out of things. Or what did we say last time? Ayahuasca, mushroom.
Yeah.
I don't know, whatever works for you.
I'm all about that. I love the ayahuasca, shrooms, things that really make your mind. I don't know. I love that. Mind opening, expanding drugs. But anyway, so to that drug thing. If you take medication for your depression, but you must have been awake enough, or at least not as depressed, to be able to go to the doctor, to get the prescription, to go to the pharmacist, to get the medicine, and to take it. There's so many steps, and sometimes the pharmacy doesn't have medication at the time. So you have to get back out of bed to go get it for the second time. There's so many steps that you have to get to before you actually can physically get help.
That's true. It's the mental health world does not make this shit easy.
Yeah.
However, I will say I just found in Florida, well, just within the last few months, there's an urgent care for mental health, and you
Oh, yeah.
get a same day appointment. It's actually all the way in Melbourne, which is far from here in Tampa, but they do virtual visits, and you just have to be licensed in Florida, and you can treat anybody in Florida. So since they do virtual visits, anybody in the state of Florida can use them. But my hope is that we open more of those, because that would probably save a lot of people from even going to the hospital if they had
Yeah.
easier access to medication.
I feel like maybe in California has that too. I'm from LA and you're from Tampa, so we're in two different worlds, really. Politically, all that. So I'm sure, I feel like they might have something here like that. I know that there's a lot of virtual therapy, which helps, like BetterHelp, and you do virtual therapy as well
I
in
do.
your facility.
Yeah.
Yeah. So I think those, making those steps easier is a huge, huge, like huge step for towards mental health. Uh,
Yeah, it's
so we'll
it's really
see.
sad, because a lot of times even like the front desk staff at doctors' offices can be rude, and then that right there just discourages people, and they're like, "Oh, forget it. I knew I shouldn't have called."
Oh, that's true.
Yeah, people with mental health issues are very easily deterred from getting help, because it already feels like so much effort to do this in the first place, that if you're going to be rude to me, forget it. I just don't need to go.
Yeah, it's like you're gonna make it worse for me,
Yeah.
right?
Yep. So it's really hard when you're in the depths of it. I think a client once sent me like a GIF or something that I felt like described depression really well, because it was like a blanket coming over the person and then wrapping the person up.
No.
Like, oh, that's pretty much what depression does. And once it consumes you like that and you're completely wrapped up in the blanket, then it's really hard to get out. So the idea is we got to either catch ourselves before we get there, or once we're there, we have to just wait for it to pass. And that's really hard.
You think it just you just wait for it?
Sometimes, sometimes we're literally just waiting for it. Not saying that you're not doing anything in the meantime. Like some of my clients, I'll just talk about someone I saw recently. Um, this person got into a super depressed state. It lasted for pretty much like a whole week, and then got good news at work. And that was the thing that kind of brought the person out of it. So it's not like they weren't going to work. They were still going to work and still trying to do things to better their lives. But it wasn't until a week later that they were actually able to feel joy about something.
Mm. Okay, so it's not as paralyzed. You can, there's levels of depression where it's not as paralyzing. I think when it gets to that paralysis point of view, that or that stage, have you been there?
I have not, I'll be honest. The most depressed, I've been super depressed a few times where I've thought like it would be fine if I got cancer. Um but but not being able to get out of bed, I haven't really experienced. Like I've been in bed and like I don't want to get up, but I didn't need to get up. There was nothing I had to get up for, so I don't really consider that the same. Like I've never had to call out of work because I was too depressed to go. That's never happened to me.
Oh, I have. I'm like, nope, they could do it tomorrow, or why don't care right now, and literally, fuck it. Like I've done that before. Uh,
And sometimes you have to. And I tell people that, like, hey, do you have PTO? If you do, let's take it and let's try to sleep this shit off.
yeah, and honestly, that works. Sometimes the whole day, when you're just in bed for 12 hours, 14 hours, 16 hours even, and when you get up the next day, you go, all right, it's time to do something today,
Yeah.
even if that one thing.
Yeah.
How did it help? What steps did you take specifically to help you?
Oh God. I've been in therapy for a long time. Um, I went intermittently for a long time. I've had different spouts or bouts, I guess you could say, with therapy, but that's where I started. And then I did get on medication. I'm on medication currently.
Mm.
Um, and Have also self-medicated with alcohol plenty.
Fantastic.
Probably with marijuana as well. Probably can't deny that one. So there's been all kinds of things that I've done to try and help myself. Therapy, I'm currently in, and I probably will be forever, I think. That's my goal. Anyways.
How would you rate your happiness, 1 to 10?
I think that I'm a pretty happy person. I do think that I get more sad probably than some people, based on what I've seen out here. But I think I'd probably give myself a 7.
Oh, that's great.
Yeah. What
I
about
think
you?
myself, yeah, I think like a 7, 8. Like I was gonna say 8 before you said 7. Now you influenced me to go lower. I'm gonna stick with my authentic truth and stay at 8.
There you go.
And it kind of bounces around there. Some days it's like, oh shit. But at the end of the day, I think my overall happiness becomes kind of unwavering because when you have a self belief in yourself, it's just it doesn't matter how shitty your day is. You're like, because you always know, okay, let me just get over this. I'm gonna go back to happy. I'm gonna get back to that place.
Yeah, I do. I have to say that even when I'm in a funky mood, it usually only lasts a couple days. And then eventually I'm like, okay, got my mojo back. I can handle this. Let's get back at it. It's a new day, that kind of thing.
Hmm. If you skipped your medication, let's say you went traveling, you're traveling for a week and you forgot to bring all that stuff. How does that affect you?
That's not going to be pretty.
Oh, really?
Oh, yeah. If I skip 3 days, I turn into an anxious disaster.
Oh, so it's anxiety that you deal with. Okay. It's
Yeah,
not anger. You're not like screaming.
I might. Who knows? Who knows, Julie? No, my anxiety gets really bad. It gets to like panic level. And the problem is, here's something that I think people don't know sometimes. When you have really high anxiety for too long, eventually depression swoops in as the savior.
What?
Yes, because think about it. Anxiety is, oh my God, I care about everything and I can't do enough and I'm overwhelmed. And depression is, I don't give a shit.
Oh. So it's
So
like
eventually,
I'm so overwhelmed. And then it's like I don't give a shit. Okay, fuck this. Fuck everything.
yes.
Oh.
So it saves us, but it feels equally as shitty. So usually people with high anxiety do experience some level of depression because that depression has to come in and rescue us physiologically. It's because otherwise we'd probably have heart attacks really young.
No. Oh
In
yeah, yeah,
that anxious state.
What's very interesting to me because when I look at you, right, I see you as such like you live such a little cute, perfect life. You know, like you're fit, you look pretty. Like physically, you look great, right? And you don't have discoloration. You have great tonation in your skin, complexion, amazing. Not a single wrinkle,
Keep
my
going. No, just kidding.
my love. And then you have two beautiful kids, and you have an amazing husband, and man, like, you guys have a cute house, and you guys have, like everything, every part of it. It's picture perfect. White picket fence, all this stuff. So it's very surprising, I'm sure, that people see you and they go, "Oh, you have anxiety," because you don't look like you do. So
Yeah.
I think I'd like to bring this up to other people that might struggle with this, but like just because you look a certain way may not be what you really feel on the inside, and that's okay. Like that dangling carrot of perfection is a dangling carrot. It changes. It's so subjective. It changes on the eye of the beholder.
Yeah. Well, and you know, people are very concrete, and if something doesn't look obvious to us, then we just have a hard time believing it. So for example, one of my clients has cancer that's not curable, and she
Mm,
do chemo treatments on a regular basis, but she's never lost her hair. She doesn't do that kind of treatment.
okay.
When she tells people that she has cancer and she does chemo, people don't believe her. They're like, "What? You're not sick. You're fine." And like
What?
jobs have been giving her a hard time about her doctor's appointments and needing off because she didn't feel well and things like that, because they just don't believe that she's sick because they can't tell.
Wow.
And the same thing happens in the mental health world, where people can't see that you're ill, so they don't they find it difficult to believe. But I remember the first time it happened to me, I was at work and this girl was talking about her anxiety, and I said, "You don't have anxiety." And she was like, "Yes, I do, girl. I have terrible anxiety." And I was like, "No, no, no. I have anxiety. You have anxiety." And she's like, "You don't have anxiety." I was like, "Yes, I do." Why do you think I'm in therapy? So I think it happens to all of us. Like, we're very concrete and we're like, I don't see you looking sad all the time, so you couldn't possibly be.
Mm. And it goes with the whole social media thing. If we look the part, if we look perfect, then maybe the happiness is there. But
That's
that's
why I like TikTok, because I feel like people keep it real on TikTok. Like Instagram, we got filters, Snapchat, we got filters, and people are trying to put their best foot forward, which is fine. I understand that there's a lot of social pressure for that. But on TikTok, I feel like people are crying, they're telling the truth about their abuse. People are just letting it all out there. I'm like, go ahead, be authentic.
is there no there's no filters or anything on TikTok? Like it literally is just
There
a camera.
are, but they're not like Snapchat level.
Okay, what people want to do is on TikTok is just they just want to be them. That's
I
what
think so.
TikTok.
I mean, that's the impression that my algorithm gives me.
Maybe that you're interested in that. How cute.
Yeah, I'm not really sure if there's another side to TikTok that I don't know of.
That's great. So steps. If we wanted to have a listener say, "Hey, after listening to that podcast, these are the steps that I can take to move forward toward a happier day." Let's say our top 5 recommendations, and I'm just throwing it out there. So, and we have not planned this, listeners, so we might be changing it up. Uh, top 5 recommendations from a therapist with 15 years of experience. Let's go. Now I'm just throwing the ball in your
A
court.
lot of pressure there. I would say number one, make yourself think about what you're grateful for.
Ooh, that's a good one.
Because
That's
I mean, Sebastian has helped me a lot with that one, I'll be honest, because I'm a complainer. I whine and complain. If my drawer doesn't close properly, I'm like, this dresser sucks. And Sebastian's like, can't you just like be happy? Like, can't you just be grateful? And he's right. Like, I have a lot of things in my life to be grateful for. And so I try consciously to think about the things that I have to be grateful for. Um, and he's such a happy, grateful person that helps a lot too. Um, so gratitude for sure. I would say for me personally, laughter. I think
oh
that comedy is so great for me. Like, it literally energizes me. So if I'm laughing and if I find something to laugh at or I find the humor in something, I do believe that laughter is one of the best medicines. So I think you can seek out things that make you laugh and make you smile.
amen on that for sure.
Um, Number three, maybe trying to do something that you enjoy. Although when you're depressed, there's not a lot you enjoy. So maybe being around somebody else who's happy. Sometimes just watching other people be happy or just being in the presence of some other people can help boost our mood a little bit. Even if we're not talking about ourselves and our feelings, just being with other people can be a mood booster.
Yeah, I agree with that. But also on top of that, what if you're an introvert and like being around people brings anxiety? I
Yeah.
guess you could be around like positive energy, whatever that means to you. If it's with people or even watching a stand up, like a stand up special on Netflix or something. If that makes you laugh without or makes you smile and be you're around happiness without actually doing that or bringing more anxiety to you.
It's interesting you say that too, because introverts the thing that's draining for them is having to interact with other people, but they could be in the same room with somebody and totally be fine. Like, I'm gonna be over here reading my book, you be over there scrolling on your phone, and it just makes me feel better that you're in the same room as me.
Uh, okay, okay. I remember hearing like Amy Schumer and Oprah talking one time, and they're talking about how they're introverts, and after a party or something, they would go in the bathroom and be like, "Oh my God, I'm so drained. Okay, okay, okay. Ready, ready. All right," and then go back out. So I thought being around people drained them, but you corrected me. It's interacting with people that drains the introvert.
Yeah. I mean, if
Okay.
there's a lot of activity going on in the room, that can also overstimulate them. But if it's just two people in the room and you're not really speaking, you're just sitting in the comfort of being next to each other, that could maybe do the trick. Um, Probably movement also, like you were saying, like one sit up or going out and walking around the block or even just getting up to take a shower. You know, when
Mm,
people are depressed, they often don't shower or brush their teeth. And
yep.
sometimes just the act of showering and brushing your teeth just makes you feel a little bit better. Like, okay, yeah, I could do a little bit here. Some people even go so far as putting on makeup. I mean, I'm not that diligent, but some of my clients tell me that they feel much better if they put makeup on.
Yeah, I absolutely agree. Actually, when I'm sick, I actually dress up normally when I'm sick or put on makeup because if I look for some reason, if I just put it on and I catch myself in a reflection or I just do that and I'm dressed really nicely and whatever, then maybe my inside could match my outside. And it eventually does. It actually helps pick me up a little bit, even if I'm not even leaving the house. I remember when I was sad a couple of times, I would wear a dress that made me feel sexy, put on makeup, and not even leave.
Ha!
Yeah.
Good for you.
And I was like, damn, I fucking look good.
That's a
And
good idea.
and it was great. It was so much fun doing it. And it became therapeutic to put on the makeup because I wasn't rushed to go anywhere. I wasn't going anywhere at all. So I was able to do all the blending and all the whatever. And if it didn't look good, I just washed it off and I did it again. And I could spend hours on my face. And it was like, oh, this is kind of nice. And it became therapeutic.
That's really cool. That's really cool. Yeah, I don't really wear a lot of makeup, so I don't even know how to blend.
Oh, when I
But
was
if that's
fashion.
your jam, I say go for it. If especially because it goes back to tricking our minds. It's
Yeah.
literally a freaking mind trick. Um, and I say let's do it then. And movement begets more movement. So if we just get up and do something, then usually we're like, oh, okay, I can also maybe cook myself some breakfast. And another thing depressed people do is they don't eat sometimes. They don't have the energy to bother eating. So if you can get yourself up and get yourself moving and get yourself some nutrition, all of those things are going to help you.
Mm. So you would say, I guess top five would be gratitude,
Hmm.
laughter,
Hmm.
be around happiness or positive energy,
Hmm.
movement, physical movement, and good nutrition.
Well, I didn't say that about good nutrition, but it doesn't hurt. I mean, I did mention that nutrition can make us feel a little bit more energized. Uh,
Okay.
but it is true that having a diet and vitamins and, just taking care of ourselves in general can help us for sure.
Yeah.
Because those things usually go out the window when we're depressed. We're like, don't care about this. I'm just going to eat a honey bun and lay here in my bed.
Doesn't sound that bad. So
I know it does sound a little appealing. Um, so, I would say making sure that you're still taking care of yourself probably is important. But also, like, I can't talk about this without saying, like, reach out for help or support because even if you don't have a therapist or a friend that you can reach out to, there's hotlines. And when you're really in a bad place, hotlines are not a bad option. It's somebody who's going to listen and who's not going to be weird about the fact that you feel like dying, which a lot of people do get weird about, which we've mentioned several times.
that's true. And those hotlines are free.
Yeah, they're free. Yep. So it's like if you just need to vent and you need to get some stuff off your chest and you need someone to talk to, someone who will listen, that's a great option.
Yeah. There's a lot of apps now that you could that addresses mental illness in that way, where I think you could call and you just talk to somebody.
Yeah.
And I don't think it's expensive. Maybe it's like maybe $10 an hour or something that I don't know. I don't really know, but I've heard about that that app, that service, and I think there's a lot more since mental health has been on the rise since COVID.
I think our inclination when we feel like shit is to surround ourselves with other people who feel like shit and listen to sad music and watch sad shows. And sometimes that's good because it helps us feel our feelings and it helps us cry and things like that. But sometimes there's too much of that and we really need to like switch up the music that we're listening to and switch up what we're watching and switch up who we're around because negative energy is very powerful. And when we're around negative energy, there's just going to be more of that. And
Yeah. Well,
say that negative energy is powerful because when I used to do groups, if one negative person came in the group, the whole group would get negative real quick.
oh,
It's easy to go down that road, unfortunately. It's not easy to pick ourselves back up. One positive person coming in the room wouldn't make a difference in the room.
really?
Yeah. If you
How
had a
sad.
group of like everybody has low energy today except one person, everyone's just going to be annoyed with that one person.
Oh, oh, they're like, this is
They're
what
like,
are you talking about? No one
shut
could
up,
relate.
Karen.
Yeah, yeah, exactly. Oh, that makes sense. That's pretty sad. And I have heard from case studies that there is a high when people have negative gossip
Oh,
versus like happy thoughts or something, right? So people are drawn to that because it gives some type of high.
oh yeah, like that's why the news is full of darkness and celebrity gossip is so popular. We love to hear the tea. We love to hear about what's going on that's terrible. And we don't really highlight positive things in the news or in the media too much. You know, it's mostly like J Lo and Ben Affleck broke up again. Oh my God, everybody's talking about it. What happened?
Oh, that's true. Maybe because it also keeps them from thinking about their own little stuff. No.
Probably. I mean, one of my clients did tell me that once that he he was telling me the news channel that he liked to watch, and I was like, "Oh, how do you do that?" And he was like, "Well, it's not my problems." I was like, oh, okay. I mean, I can't watch the news. It makes me too sad and
I
anxious.
know, I know, me too. I'm just like, and right before you watch it, and most of the time people watch it before bed, and it's
Yeah.
like, yeah, how do you watch it before bed? Basically, you're for me, I feel like I'm marinating in all that sadness, and then you go to sleep. Then you marinate in your brain for 8 hours or whatever hours of sleep. Then you wake up, and it's like, how do you feel refreshed and happy?
Yeah. Yeah. I agree. I mean, and I'll have bad dreams too. My dreams won't leave me alone.
Oh
I'll
yes,
be
that's why.
dreaming terrible things.
Yeah, I can't watch gore. Like gore videos, don't send. Please don't send me. I'll get a nightmare. I absolutely have a nightmare that night, and I just can't do it. It's like, nope,
Yep.
whatever. I don't care. I can't do it. Not gonna do it.
Yeah. But, you know, everybody's different and some people are sensitive to it and some people aren't. So I don't know how those people do it, but seems to work for them. So who am I? All
I
I'm
don't.
saying is when we're in a depressed state, we should be careful how long we let ourselves lay in it because it can become very difficult to get ourselves out if we're in there for too long.
Yeah, I definitely agree with that. So, wrapping up on everything, I am really glad we talked about this because I think in internal happiness is really the only way to go. I know that throughout my journey of depression and where I am now, and my level 8 happiness, uh, I feel like I just feel like it's so important to remember that our outsides it could be stormy outside, but at least inside it's unwavering. Your unwavering self-belief of yourself. That's really what I think the key to happiness for me.
Okay. I love that, and I love that for you. And I guess in conclusion, I just want to remind everybody that if they are in a really depressed or negative mind frame, there are a lot of things you can do about it. It's definitely not hopeless. And even when you think you've tried everything, there's always something new out on the market. So we don't have to give up. And I know it's not easy to always fight, but you don't have to give up. That's the good news.
I love that. Thank you, Alicia. And thank you, listeners, for being part of our journey, or letting us be part of your journey too. So join us next week as we dive into marriage and relationships. This might be more than one episode. It's such a huge topic. But anyway, so you could find us anywhere on Apple, where Apple and Google podcasts are found. And we'll see you next week, guys.
All right, see you later. Bye.
Bye.